Hi, I'm Dr. Cheryl Burgess. I'm here at the Aerolase booth. We're doing a demonstration on skin rejuvenation. As we age and our face is constantly exposed to sunlight and room light, any type of light can cause changes in the skin. So hyperpigmentation is one of the most common conditions that we see just due to sun exposure and incidental light exposure. So we have Katie here who is doing a rejuvenation treatment. She is using the Aerolase NeoDerm, and this is basically the reading settings are 4.0 at 2 frequency. And we're seeing the patient here. Seems like she's doing okay. I don't see her flinching. Do you want to describe what the sensation is?
Like it's like a hot air blower.
Like a hot air blower. She says it's comfortable. And actually, Katie has done a couple passes on you already. And so we see that it targets the pigment in the lower epidermis and upper dermis without affecting the skin integrity. So this is a device that I use in my office and have been since 2010. And it's a device that I use pretty often on a daily basis. And what we see here is rejuvenation. We can see it being used in acne, hyperpigmentation. We also use it, say for instance, if you have fungus or a wart under the nail or on the nail bed, and where we can use the different size lens to penetrate nail. So before, when we'd have to evulse the nail to get to the underlying wart or fungus in order to treat, we no longer have to do that. And so this is the variety of different lenses that are available. Right now, Katie is using, this is the 6 millimeter, 6 millimeter size lens, and the largest lens is going to be a 10 millimeter. So it goes from like 3 millimeters all the way up to 10 millimeters as far as coverage and treatment of the different conditions. One thing that I really like about this product is that with this condition, a lot of people who are in medical derm will use it instead of prescribing isotretinoin. And there have been some papers that have been published. Michael Gold out of Nashville published a paper in using, when you're doing low dose isotretinoin treatment, say you're using 20 milligrams a day, you can also use this device to control the cystic acne eruptions and outbreaks without causing any scarring or any adverse events in using laser and isotretinoin. When this treatment of isotretinoin came out back in the 80s, we were told that you could not use a laser for at least a year. Now we know that certain lasers will not harm the skin or cause scarring. How's it feel now?
Great.
Feels great.
It doesn't hurt at all.
Okay, so we're turning up the volume
She's
here.
not there, but she's actually Armenian, so that's why I kind of
Yeah.
allowed to see how she did, but she's handling it well.
Yeah, so she is handling this well. She has a little bit of increased pigment because she's Armenian, but she can tolerate this. So the lighter your skin type, the higher the energy mode can be. So we started out at 4, now we're up to 5 with her, and she's tolerating it very well. So you can barely feel it
That's great.
at the increase, very good. So just talking about the Aerolase portfolio, there are several devices. This is just one called Aerolase NeoDerm, which is only sold to dermatologists. It's not sold to estheticians or med spas. We also have another device called Aerolase Era. An Era is a superficial resurfacing device that is used whenever you have more damage to the outer layer, the epidermis. And there's also a reverse technique, and where we're using this device actually combined with the Era. So it's usually treatment with this NeoDerm, and then in the same setting, they're using the Era device on the same areas and that they treat it with the NeoDerm. Okay, so for the most part, the treatment with the NeoDerm is excellent for any practice, whether it's cosmetic practice, medical practice. It has over 30 different indications for the NeoDerm. The Era is more like a superficial treatment, and for the most part, it's a resurfacing type of laser. Then we have the XC308, which, since my training background was in vitiligo, it's one device that I still use to this day in using narrowband UVB. And that we treat a lot of depigmented or hypopigmented conditions with, such as vitiligo, such as pityriasis alba. And so that's very handy. And then right now I'm getting ready to start some clinical trials in the fractionated device. It's a lens piece that goes onto the Aerolase Era. So the portfolio is vastly improving and growing, and pretty soon we're gonna have a lot of lasers for all the different indications we may see in our private practice.
Done here.
Okay, we're almost done. You want to give me some feedback of how it feels? Okay, so Dr. Kardashian, who is our model for today, from Fresno, California, she just commented that, and she's had a couple passes with the 4.0 energy mode and the 5.0, and that she barely even feels it. And she wasn't pre-treated or numbed to start with the beginning of the treatment.
Just going over her like pigment little spot, like in
Yes.
the spot she has.
So now Katie's doing more spot treatment, and where as she's done all the passes, now what she's doing is going on over the problem areas, and the patient will get up and walk out, and you won't really see any type of exfoliation or erythema with the skin. So this is a type of procedure that you can come get done at lunchtime and go back to work. Okay?
Awesome.
Great. Thank you, Katie. Thank you, Dr.
Thank you, everybody,
Kardashian.
for listening to your